And why I say this is because this is a human resource that was recruited during COVID-19. They gained very valuable experience, that is of pandemic response. And now what we are seeing is a government that wants to continue with some frustrating terms, because, and our issue is not actually the renewal itself. What we are taking issue with is renewal under the same conditions, terms and conditions. These health workers, which is a skill mix from doctors to a mortician, they are paid half the salary that is paid their counterparts on PNP, on permanent and pensionable. And that is where we also do wonder that why is it that the government keeps asking us to respect the law when they themselves cannot actually comply to the law that they have put in place. There are laws in this country that talk about you should not be able to discriminate anybody. Article 27 of the Constitution of Kenya. Equal benefit to the law for every Kenyan. That law, under the Public Service Commission Act, Section 45, provides requirements on when the Public Service Commission can actually engage any Kenyan on a contract. And the last requirement is that that person you're engaging on a contract must not qualify for any other terms. And any other terms here, it's permanent and pensionable. And it's not the engaging organization, it is the person you're engaging must not be able to be employed on any other terms, which is permanent and pensionable. Then under SRC, we see that they have been given principles of fair remuneration in terms of people doing equal work must also be paid equally. So you wonder, why is it that the government requires us to obey the law, but they themselves cannot even obey the law, leave alone even the law that we have enacted. The law of natural justice provides that if we do work of equal value, if I'm sitting with a clinician in an outpatient and I'm seeing patients, why would I be paid double what they are being paid? And that is what we are taking issue with. So we are not saying that do not renew. We are saying you should be able to make their terms better. And by making them better, it is having them on permanent and pensionable as we go forward. And this government promised us in their manifesto that they were actually going to employ 20,000 healthcare workers. And now we are wondering, if we cannot be able to put these ones on permanent and pensionable, how are we going to realize another 20,000 if people who are already being paid, you just need to add some money and put them on permanent and pensionable, you cannot be able to do that, then how are you going to employ another 20,000? So why I'm saying we don't learn is because this is not the first time. Our country has adopted a very bad practice of use and dump. We first train and dump, where you train, you even have issues taking them on internship. You saw the doctors agitating the other day, and the ministry posted them. You saw the clinic officers agitating the other day, and very soon they are also supposed to be demonstrating on the same internship. They have not even qualified. Then when you qualify, you are not employed. When the government employs you, it gives you a short-term contract and then dumps you. We have health workers, all cadres, who are employed on what is called internship. You can imagine somebody who had done the mandatory legal internship for 1 year. Then the government employs you on another internship which is not governed by any law. Then after 1 year, they dump you. During COVID-19, there is another cohort of anesthetist and other health workers that was also employed for 6 months. When the contract came to an end, they were also dumped. So they have adopted this train and dump and use and dump policy practice. And on top of that, they're even preventing them now from immigrating to other countries. So our health system, especially the governance, the leadership and governance part, needs a reboot so that we can be able to learn from the previous lessons And as we are talking about today, we harness this human capital so that we can be able to achieve universal health coverage.